Again, moderating the second panel is Jared Moffitt, the Executive Director of Regulate Rhode Island. We have with us State Senator Joshua Miller, the primary sponsor of the Marijuana Regulation, Control, and Taxation Act. Mason Tavert, again, will join us in the second panel, Director of Communications at Marijuana Policy Project and co-director of the 2012 Amendment 64 campaign in Colorado. Pat Oglesby, former Chief Tax Counsel to the U.S. Senate Finance Committee and founder of the Center for New Revenue. And Michelle McKenzie, public health researcher and advocate for people in recovery from substance dependence. Jared?
Great. All right, thank you, Diego. So this panel is going to be a little bit different than the first panel. The first panel is a little more fluid conversation, a little back and forth. For this panel, we kind of have I like to think of it as a block of information for each panelist to kind of get out there. But before we get into that, we're going to, just so everyone knows, be focusing a little more on the concrete in this panel. So we're going to be talking about the specific bill and proposal that has been introduced by Senator Miller and sponsored by other legislators here in the state. And we're going to be talking more specifically about what's happening in Colorado, Washington, and that type of thing. So just keep that in mind as you write your questions. But before we jump into that, I want to just have each panelist just take 30 to 60 seconds to quickly just explain who you are and what your work is and how your work intersects marijuana policy. So Michelle, why don't we start with you first?
Hi, my name is Michelle McKenzie, and I've been doing HIV prevention research for the last 17 years. And my interest really is in drug policy advocacy, including marijuana reform, policy reform. And doing the HIV prevention research, I've worked primarily with people who are leaving incarceration and re-entering the community and addicted to opioids. And in that work, I have seen it really, I won't go into it, people in the first panel covered very well how our society has tasked the criminal justice system with a task that it simply cannot do. We're spending way too much money, it's ineffective, and so the people who are addicted to drugs are not helped by their experience in the criminal justice system and incarceration. And particularly for people who are addicted to opioids, are at very high risk of death when they leave incarceration. So it's been through my experience as a researcher in the criminal justice system that I think that we desperately need drug policy reform.
Thank you so much. So Senator Miller, we'll go to you now. Maybe you could say a little bit about why you've taken up this issue as a state senator.
There are a lot of reasons, and it's not only tax and regulatory legislation that I'm involved in. I see them intersect. In the previous panel, we talked about another question that would be directed later. One of it was about revenue towards treatment and education, and the decrim legislation, which I had a commission that led to recommending decrim, and then I sponsored the bill that enacted decrim.
Can you quickly say what, just in case anyone doesn't know what decriminalization that law is, can you just explain?
Decrim resulted, and it's been in effect since 2012, allows for there to be only a financial penalty, a fine of $150 for possession of an ounce or less. And 40% of that revenue is specified to go to education and treatment. And we've taken that into the tax and regulate legislation to have 40% of that revenue go to education and treatment. The education component is for minors predominantly. And what led me to this, Scott Slater and his father Tom, who were leaders on this, also a leader on this in the legislature, was Rhoda Perry, specifically dedicating most of her time to the medical marijuana movement. And I was proud to listen to her and learn from her as a member of the health committee, and she left 2 years ago to left the Senate, and I took over her role as chair of the health committee. And with others like Scott Slater, we took on after the successful decrim, took on tax and regulate. And I don't take it on just because of the marijuana component. I take it on Also, for a lot of the issues that Michelle's involved in, is that it's in the disparities that were talked about in the other panel on the racial disparities. I'm known for being an advocate for gun control, and how do you relate gun control to drug treatment or to tax and regulate? I do it because there's a culture of violence around drug dealing. And part of that culture is specific to what Beth talked about. And why is that specific to a neighborhood? Is because in that neighborhood is also gun violence that is related to drug dealing. And also it's opiate dealing. And so there's an interconnection with a lot of work I've been doing on mental health parity, overdose, and separating those problems, which have much more serious implication, from those with much less serious implications, which is the trade of marijuana. And when Patrick Kennedy, who is somebody I really admire, talks about a gateway, and marijuana being a gateway, and that's why he navigates that argument, I talk about the gateway being a drug dealer and not necessarily the drug. And if you can separate and tax and regulate something that has a lot less harm, or some have advocated no harm, or minimal harm, from those things that are have a lot serious implications on our society, then that's part of the motivation going forward.
Great, thank you, Senator Miller. So Pat, I want to turn to you now just a little bit, talk about the Center for New Revenue, and how did you get interested in marijuana tax policy specifically?
Well, I'm a tax lawyer and work for Congress writing the details of tax laws. So I have this narrow mind that I just look at little issues and details, and nobody, this was 4 or 5 years ago, I got interested, nobody was really interested in the how you tax marijuana, or how you get revenue from it, maybe state monopoly. But and my hat's off to the folks who serve in the legislature, because I think it's easy to come to the conclusion that what we are having now does not work. But to think of what the alternatives are and how to substitute for something that will work is what I've been working on, thinking of. I mean, there are other substances that we might be taxing. We could tax alcohol more than we do. We could tax carbon more than we do. But marijuana needed a lot of work, and so I set myself up to do that. And part of the pitch is that for the average person, what's in it for me? And the answer may be that there's some revenue coming in to fund the kind of programs that are going to make the state better, or to cut taxes, or to pay down debt, or to use that there is a revenue card that is available as part of the legalization debate. So that's what I'm doing. Great.
And it's worth mentioning too, Pat, that you were cited as an influential person in the Oregon initiative that passed, and that was of note, and you've been quoted here in Rhode Island, so it looks like your work is really having an impact on the real world. So thank you again for being here tonight. Mason, we already heard a little bit about your background, but so that way I'll just want to go ahead and kick the first question off to you. Let's start with Colorado. What is going on in Colorado? There's obviously been a lot of conversation about what the outcomes would be. You actually live there. You worked on the campaign to legalize and regulate marijuana. What are we seeing in Colorado right now?
Fire and brimstone. No, actually, it's still quite nice. Really, the day before this law passed, there were millions and millions of dollars in marijuana sales taking place in Colorado every year, and the day afterward, there were also millions and millions of dollars in marijuana sales that will be taking place every year. The only difference is that now they're taking place in regulated businesses that are collecting taxes, paying taxes. They are selling their products, and they're packaged, they are labeled, they are tested, there is security present. here's one really interesting thing that just happened that brings us to mind. In Washington, for example, there was just a large auction with a wholesale marijuana cultivator that was providing marijuana to retail businesses and brought in like $600,000. And there were, members of the Washington State Liquor Control Board, which is the regulating body there, were there and were seeing it. It's, think about that. I mean, this is a $600,000 drug deal taking place. There are state officials there to make sure everything is going okay. It's being done in a organized fashion, accordance with law. I mean, usually there would probably be a lot of thugs with guns at a transaction like that. That's the difference. So in Colorado, one of the numbers someone mentioned, there were 10,000 jobs. Actually, there are now more than 18,000 badged marijuana business employees in Colorado. And those are just people who work directly in retail stores, cultivation facilities. They're actually touching marijuana. When it comes to people who are working, making POS systems, people who are making the packaging, electricians and contractors who are building these warehouses and so on, the amount of business that's being generated, not just in the marijuana specific industry, but for other industries, is absolutely enormous. So really things are overall going incredibly well. The state has already brought in tens of millions of dollars in medical and adult use sales and licensing fees. And, the sky hasn't fallen. Everything is still going quite well. The state has one of the fastest growing economies in the country. The unemployment rate has gone down. Dropout rates have gone down over the last 5 or 6 years. High school graduation rates have gone up. Teen use, and this is precedent we'll get into, but teen use has actually been trending downward in Colorado since 2009, which is when our medical marijuana businesses began to open. Nationwide, it has been trending slightly upward during the same period of time. So clearly we're not seeing any sort of significant relationship or increased use. Things are going very well.
Thank you. Well, so now we've heard a little bit about what's happening in Colorado. Senator Miller, I kind of want to get your proposal on the table to talk a little bit about, just outline for us some of the main provisions in the legislation that you propose.
The main provisions in the legislation that to be taxed about 20%. That it would be similar to Colorado, but I think that what I want to get to more rather than the specifics, because I think that will change going forward. One of the things about legislation and the attempt to get something passed when your priority is not necessarily somebody else's is to bring all the facts, and I want to give kudos to you, is that you've brought the level of discussion on this issue to such a sophisticated and mature and intelligent level in Rhode Island that we now have a chance, partly because of your work. And every piece of legislation that I've been involved in, and I've been proud of a lot of things that I've done that have to do with marijuana, or have to do with the environment, or have to do with health insurance reform. They've all had a major component of conversation, discussion, and compromise being the key thing. And also having prepared like a 30-second pitch, a 1-minute pitch, and if somebody is still listening, you might even sit down and talk to them about the issue in detail. And you have to have all those things prepared as a legislator and as an advocate. And what we have to be prepared for, if we consider this our priority, is a lot of compromises. And understanding that we may not like everything we have to do to get something passed, but we have to be positive that it's a first step that's going to lead to something that maybe we feel better about after the fact. But we get our foot in the door by getting something. And I feel that if we're going to be successful this year or the next year or the year after, it'll be based on compromise and having a series of arguments that we feel will work with different people. Some of them will be your revenue arguments. One of the revenue gateways that we have is that Newport lost its ability to have table games, so we have a huge revenue gap. And the people who are interested in revenue and revenue only will now have to look at us as a potential revenue source. Then there are the people like me and Michelle who look at it as separating vulnerable youth from the potential of encountering a drug dealer that would initiate their relationship through marijuana and then potentially move on to something that'll kill them. And so that's why I'm involved, and I will use that argument. And then we go to what happened in the debates, whether, here in Rhode Island or elsewhere, where everybody says, wait and see what happens in Colorado. So some of the compromise, because they all said wait and see, they didn't say no. And so what I feel I'll propose as a compromise going forward is, well, the big issue everybody brings up in Colorado is edibles and drinkables. So let's start by leaving those behind. Leave those behind to start. So where does your argument end up? We're leaving behind the main highlight of what has been the controversial component in Colorado. We may have to start small. We have a very non-controversial 3 compassion centers opening up without a real history of any problems in the way they've been set up. Let's start with the compassion centers and create thresholds of volume, and then let cities and towns, so cities and towns don't feel like they're being, some cities and towns may be ahead of the game, some of them might be behind them on the way we're discussing this. But the cities and towns who want the revenue, because there'll be a revenue sharing component between the city and the town that, where a center is located, and the state, let them start based on a volume threshold. So those are some of the ideas on the art of compromise that may have to take place in moving forward if you want to do it sooner rather than later.
There you have the art of politics. So do you think, so just one more follow-up question, given the numbers that we just heard Mason talk about, the number of jobs, I mean, I just heard that over and over in the election cycle. Do you think that's going to be something that is persuasive to legislators as well?
You heard every candidate who was taken seriously, not only in Rhode Island, but especially in Rhode Island, the 3rd highest unemployment rate in the country, that jobs. Well, this industry creates jobs. That's why they liked gambling, is because it created jobs. It was the main point. So there is a job component on this, and there's also a revenue component. And what we haven't seen in Colorado that we would see in Rhode Island is that there are 30 million people located within 150 miles of Rhode Island. So we have a marketplace that is actually greater than Colorado. So when people see the revenue numbers in Colorado, and they talk about a state of 1 million people, or the state of 5 million, Colorado?
5.5.
5. It's not the statistic we should look at. It's the marketplace within the most densely populated part of the country, and the first out in what they can do with that geographical advantage.
Pat, I want to turn to you now, because I think it kind of segues nicely to talk a little bit about, what your basic approach, if you can, just kind of, briefly give us an idea of what are the challenges that we face in designing tax policies for marijuana?
The challenges are so tough that I would say try monopoly instead, but one of the challenges, which may not work in the federal law, it may, but one of the challenges, that reminds me of the story of 2 friends who disagreed vehemently. They said, well, how can we reconcile our difference? Well, they said, but who in the community is a person of peace and reason? Who can help us reach agreement? And they said, well, in our community, it's the rabbi. Let's go to the rabbi. So the first friend goes to the rabbi, tells the rabbi his story. The rabbi listens and says, yes, you're right. And he leaves, and the second friend comes to the rabbi. The rabbi listens to his story and says, yes, you're right. And he goes away. Now, all this time, the rabbi's wife is behind the curtain and has heard it all. And she comes out and says, these guys, they were in complete disagreement, but you told each of them you were right. How can this be? And the rabbi said, you are right. And in the marijuana context, it's the price of marijuana. And the first said, marijuana price is gonna be too high. And we still have, we have taxes, we have regulations, we have startup costs. And in Washington State especially, you see that the prices are much more than the black market price. You've got people who are not paying the tax, they're staying in the black market. You've got people who are pretending to be sick to get a medical card so they don't have to pay the tax. So the after-tax price is too high, and the first friend was right. And the second friend said the price is going to be too low. Now this is a political judgment, but you've got three worries of if the price gets too low. And it might get too low once you get industrial scale production. You've got something now that sells for $100 an ounce, $200 an ounce, $300 an ounce, and it's kind of like oregano to produce. It's not getting that price because it's hard to produce. It's getting that price because it's illegal. And once it becomes legal, to the extent that companies can churn it out like they can churn out oregano, when you get mass production and move out the learning curve and you have economies of scale, the production price, the production cost is going to be tiny. It's going to be, if it's $10 an ounce, I'd be surprised. It's going to be more like $2 an ounce. And then if there's competition in the market, that cost saving will get passed on to consumers, and that's where the danger comes up. And it makes it very difficult to come up with a scheme that's going to endure, and you probably need adjustment. And the dangers are, first, in the long run, that the mothers of America worry that little Johnny that marijuana is so cheap that somebody's brother is buying marijuana and it's so cheap that they're passing along selling it and little Johnny's getting it. That's the long run worry. In the short run, it's that the federal government, who is still looking at how legalization is working, its top priority is no youth use, or keep it away from the kids. And its third priority is don't let it leak out of state. Now that's different from tourism, from folks who come and buy it. But if it starts showing up that Rhode Island manufactured or produced marijuana is all over the place in New York, and that's the market. In New York, then the federal government has a problem. And in the medium term, the third problem is that if you have a change in administration in 2017 and you have a President Huckabee, or you have a President Jeb Bush who was against the Florida marijuana medical initiative, that the hands-off policy that the federal government is exercising now, that could vanish overnight. So it's not an easy problem to solve. So my hat's off, Senator.
I do want to say one thing though, Pat. You have been quoted saying that you did look at the bill that Senator Nolan proposed, and you saw it was a per weight tax versus what they've done in Colorado and Washington. I believe also Oregon and Alaska have taken the route of taxing per weight. Can you speak a little bit about why it would be better to have a per weight tax as opposed to percentage?
All right, I'm glad nobody's walking out right yet when we get into the capillaries of the tax thinking. But if you have and the bill is $50 an ounce for bud and $10 an ounce for trim for everything else. And if you're worried about this price collapse, and you're worried about the moms and President Huckabee, that if you have a tax that's based on price, 50% of price, and the price is $200 an ounce, okay, well that's $100 tax. If the price is $10 an ounce, then the tax is $5. It's going the wrong way. The tax should be going up, in my opinion, should be going up as the pre-tax price goes down. Oh boy, getting into it now.
Can I just add something to that?
Yeah, absolutely.
See, this is where you let people steer the conversation based on what their motivation is. My motivation is not financial. My motivation is saving lives, is saving people from overdose. If there was, there are 200 overdoses last year in Rhode Island. And there had historically been about that level for a few years, and it's not growing anymore now. Which I equate when I argue it to being a plane crashing at TF Green every year? Would we sit around and wait for something to change without trying to do something about it? This is one of the things I've done, not only one of the things I've done. I had a good year in opiate-related legislation last year that I won't go into. But so I don't care how you tax it. If your interest is in the best revenue model, go ahead, design the revenue model if that's your priority. It's the revenue side of it. To me, it's a vehicle for how I get done for why I want to get it done. And so if you have a better way to design the financial components, as long as we still have a treatment component in there where we fund treatment, then do it however you'd like.
So it sounds like you have what you want there, and you're sort of open to discussion about other parts of it. Well, that kind of leads me to bring you into the discussion now, Michelle, because you are a public health researcher, and you do work on issues of overdose. What is, and I know you've looked at Senator Miller's proposal that we had this year. It may change a little bit, but what is your basic take on that proposal? How do you approach that as a public health researcher and look at that?
I think that one of an important benefit of legalization and regulation is going to be for people who consume marijuana. They're going to know what they're getting. They're going to know potency, purity. They're going to know that it's not laced with heaven knows what. So there is just the fact that people are going to know what they're getting. And with regard to overdose, there's been some preliminary research that looks at people using marijuana, medical marijuana, and then not medical marijuana when it becomes legal, is for manage pain. And in fact, in states that passed medical marijuana, there's been a 25%, it's less of an increase in terms of opioid overdose deaths. So while we have seen, as Senator Miller suggested, we had over 200 deaths last year. We're at about over 170 right now. And in the last decade, we've seen a continuous rise of opioid-related deaths. If we can have a tool in our tool chest to address this terrible overuse of opioids, then I think that that's a wonderful thing. Additionally, I think it's important that we have more of a line, between legal access and illegal access. And I'm particularly interested in that for everyone, but particularly for youth, because right now, if people access marijuana illegally, they have access to other and harder drugs. This is also true for youth. And finally, and importantly, 40% is set aside for treatment, education, and we'd like to add recovery support in there. And I actually would like to ask Senator Miller, I know that this has been, we have not historically been very successful in this state with really setting aside money. It's all been sucked up by the general fund. So could you speak to how we're going to do it differently? And how, as an advocate and a citizen, I can, and others, everyone here, can make sure that it is in the case that when this bill passes, that 40% really will be used for treatment, prevention, and recovery efforts.
Do you mind if I get to that?
Sure.
The next step, and it's also a correction we have to make in the way that revenue has been used to decrim, is that it doesn't get directed the way it was intended. And the main effort that we would look for going forward is to make sure it's designed so we can easily track the money, make sure it's going where it was intended. So it's a priority, and we know it needs to be fixed, and we know it needs to be in place in a major way going forward, and that when I talk treatment, I consider recovery a component of that, so it's there for me.
Well, Michelle, I wanted to also ask you, because you're also a mother of 2 children, and you did sort of touch on a little bit about teen use and that being something that we need to look at. What, as a parent, what would you say to parents who may look at this issue and have those concerns about their teenagers? What makes you feel comfortable that this is a good route to take?
little Johnny is already exposed to and has access to marijuana. Our high schoolers have more access to marijuana than their parents do. 90% of high schoolers say that it's fairly easy or easy to access marijuana. We're doing a terrible job protecting our children from access to drugs. And my own family's experience is that, some family members have used marijuana and not had a problem. I had a family member who actually used marijuana young and it did exacerbate mental health issues and had a lot of problems with it. I feel strongly that we have to protect our youth more, that the current drug policy doesn't do it, and I think we're going to have more control when we legalize and regulate. I think it's going to make a big difference in our schools where the classmates are the drug dealers, that there is not going to be marijuana, is not going to be part of the mix. Alcohol is not part of what's sold in our high schools now. They don't go to their classmates for alcohol in the schools. And the fact that youth have access to marijuana through the illegal market, they have easier access to other drugs. So it's absolutely true that the vast majority of people who use marijuana are not going to use other drugs. That's absolutely true. But for people with problems of addiction, possibly problems of mental health issues, once they access marijuana illicitly, then it's going to be easier to access other drugs for them. And I think that that's a very important point, and that what we're doing now is absolutely not working. And in Rhode Island, and it is, I believe that we're going to do a better job. And with regard to, is it going to make kids use all the more? What we've seen in Rhode Island is since the decriminalization of marijuana and since the opening of the compassion centers between 2011 and 2013, there's actually been a slight decrease in marijuana use, and that we saw that same decrease, almost exactly 2 percentage points in Colorado as well between 2011 and 2013. So I don't believe that the message that we're going to be sending our youth is that, oh, guess what, everybody can smoke now. I think what we're saying is, we have made very bad choices in the past. We're willing to really look at that openly and rectify them, and that still does not mean that little Johnny can use marijuana.
Thank you. So Mason, I want to kind of pick up a loose end on something that Pat said about the potential for Mike Huckabee president. What do you see? I mean, because again, you bring a real national perspective with the growing majority of support. Do you see that there could be an issue federally versus state law? Where do you see that going?
Well, if Mike Huckabee gets elected and a majority of Americans think marijuana should be legal, Mike Huckabee will have to recognize that that's what the people elected him want. I don't think that we're going to see any sort of significant backward steps. It's just a question of how quickly we see the forward steps. When the Justice Department came out with its memo in 2013 saying that it was going to refrain from interfering in Colorado and Washington and other states that are actually regulating marijuana as long as they're doing it appropriately, we didn't see a large coordinated Republican response bashing Obama. Think about that. Obama can do anything, and there will be a very large coordinated Republican response saying it was the wrong thing to do. And when they came out and said, we're not going to worry about, or at least we're not going to fight marijuana being made legal in these states, they didn't really say much of anything. That's very significant. And that's because Republicans have finally started to figure out that they have nothing to really gain by fighting against marijuana policy reform. It's not as if a Republican doesn't fight it, someone's going to vote for the Democrat. It's really just not worth it for them. We haven't really seen it become a big issue in primaries, at least not in any very significant fashion. Ultimately, people see that this is the direction in which the country's headed. Look at, when you look at the Republican field when it comes to presidential candidates, Rand Paul is certainly up there. he recently came out and said that he didn't think Congress should interfere in DC, where they just passed a measure to make marijuana legal for adults. We're starting to see this all over the place, Republicans coming around on this, and, this isn't to say Democrats are all great, certainly not the case, but I really just don't foresee any sort of very significant steps back, especially when it comes to after 2016, by that point, by the time they're elected and they take office in January of 2017, we are very likely to have upwards of 8 states or more where marijuana is now legal for adults. We expect to see measures passed in 2016 in Arizona, California, Maine, Massachusetts, and Nevada. Hopefully we'll also by that point have seen a couple state legislatures pass measures. Rhode Island, certainly hoping will be one of the first, if not the first. Vermont also up there in the first states that will likely do it through legislatures. At this point, we're looking at a very clear movement toward a new policy. And to try to stop that will just look horrendous. I mean, that's basically like Mike Huckabee showing up and saying, I want to go back to the Defense of Marriage Act. I want to go back to making, sodomy illegal. I want, the other stuff that he thinks. But he will recognize that that would not be good for him or his party, and it's not something that the American people are really going to go for. And I think that the same thing will be the case here.
So I want to ask our volunteers who are back there to just start collecting the additional questions that we have. Bring those up to me if you can. But Mason, if you don't mind, I do want to kind of just follow up. You mentioned Washington, D.C. Now, on the previous, the most recent election day, we did see an addition of 2 states, Oregon and Alaska, adopt policies to regulate marijuana like alcohol. That's not quite what happened in D.C. Can you talk a little bit about what happened in D.C. and what the implications are for that going forward?
Sure. Well, essentially, the voters in Washington, D.C. passed a measure that removes penalties for adult possession of a limited amount of marijuana and home cultivation of a limited amount of marijuana. It's still subject to congressional review, so it's not in place yet. But really, it's just part of the solution, and that's the backers of the initiative knew this, and we've been working very closely with the DC Council for the last several years. This past year, we passed a decriminalization bill that reduced the fine for possession to $25. The DC Council, pretty cool, to be quite honest. The incoming mayor, she is also pretty cool. She said that she's fully supportive of this type of law, but she wants to see the regulatory infrastructure. She wants to see the taxes. She wants to see the regulation, and that's what we're working on with the council. And we hope to pass a bill this coming year that will establish that regulatory framework. There was recently, just 2 weeks ago, a hearing on it. It is supported, and what we want to do is now that the voters have said possession is legal, there's even more of a need to develop that regulatory system. So it's really going to come down to whether there's going to be a fight in Congress over whether Washington, D.C. should be allowed to do this. And, it's worth noting that Washington, D.C. passed its medical marijuana law, when was it, 2000 or 98? But it really wasn't implemented until just this past couple of years. And that's because Congress was holding it up. Now, this is a question of what the Congress will do in the coming years, or even this year now with the Republican takeover. But what we've seen is that there's been people who are watching the situation have said they really don't see Republicans wanting to make this their first big fight. It's just not a priority. And while there are a couple jerks here and there who like to go out of their way, Andy Harris from Maryland in particular, they are unlikely to see a whole lot of support. It might get held up a little bit, but ultimately it's inevitable. I mean, at this point, there are now marijuana stores within walking distance of the U.S. Capitol building. And as these members of Congress can see this, and as they see all these other states doing this, and as they hear about state legislatures passing these laws as well, they're just not going to have the power or the energy to try to prevent this.
Thanks. Okay, so now we're going to go to some questions that we got from you in the audience. So this might be a good one for you, Senator Miller. In other states, legalization was passed through voter referenda. We've seen that with the 4 states that have done that. The question is, will that be the case here in Rhode Island? It sounds likely not, but how does that work? How does the ballot process here in Rhode Island work? And is that a possibility that we could have a referendum on the issue?
Rhode Island's a non-referendum state. And
It's totally not even possible through the state legislature to put something?
this kind of thing, the only thing that gets to ballot in Rhode Island are bond issues. There's no social issues or legislative, things that could have a legislative component that are brought forward on record.
So it's only bond issues and that still has to come through the state legislature?
Right.
Okay. All right. So another one that's addressed to you, Senator Miller. What are some of the strongest and most legitimate criticisms of legalization? I guess it says here, you've already mentioned some, but what do you hear, I guess, as a concern from your colleagues as something?
A private concern or a public concern, because
Doesn't specify.
as Beth talked about, law enforcement against prohibition. Her experience and my experience in talking to people who are involved in LEAP is how many members of LEAP?
Well, there are tens of, it's like 80,000 members, but
Yeah.
speakers are always people who have a background in law enforcement
Yeah.
or.
So there's about 80,000 members of millions and millions of people who have been involved in all the components of law enforcement that they could and do come from. And I've heard the story from LEAP members of how they're a member and they're walking like in a parade or they're at a meeting, and the people who are still involved in law enforcement who when they talk off camera or privately, agree with it. As soon as they're on camera or public, they state how prohibition is the right way to go, and decrim or anything like it is not the way to go. So we have that in the legislature also. We have that in prominent members of the public who speak publicly about it. Privately, they tell you that it's a big mistake. Publicly, and the other way around.
Interesting.
Yeah, and so this is a problem that we deal with every day in Rhode Island or any public discussion, is that my bill on tax and regulate last year probably had about 8 signatures out of 38. I know that there is a majority support, but they won't publicly discuss or.
So does then, what's happening in DC, for instance, and other states, do you think that will give legislators a little more confidence that, this is seeing the polls that the majority of people support it? Do you think we'll start to see more people come out and say what they truly believe?
Marriage equality, I think those who are involved, and I was a proponent of marriage equality, couldn't imagine that we would make the progress as quickly as we ended up making it. Right? At the beginning of the session for marriage, of the year that we passed marriage equality, there was a significant minority of support, especially within the Senate, and by the time it passed, I forget, it was a significant majority. I see that kind of trend in tax and regulate, not only based on Oregon and Alaska and DC, but based on the way the conversation is starting to evolve.
Great. Well, that's encouraging. Pat or Mason, this may be a good one for either of you. Is it true that marijuana is the United States' largest cash crop? And if so, what's the implication of this statistic? Either of you take that question?
No.
Just not.
Yeah, that was a story that came out a while back, but I'm fairly certain, I'm actually certain that it's been debunked. It's not the largest cash crop, and as Pat was referring to, it will certainly be less so as costs do go down based on becoming legal and the type of competition you see in the market. I do have plenty of thoughts on that I was going to interject with, but I don't know if we are going to get into that whole question of the cost and the impact of the cost changing or whatever. If we go there.
I think maybe we should, leave that for another time, because there are some more questions to get to. So this question is about, so how do you feel, and I guess this is open for anyone to take, how do you feel about the emerging trend called dabbing involving the use of a blowtorch and THC concentrate, butane hash oil? Do you think this trend will negatively affect the marijuana community as users? Are they looking for a stronger high? So this is about concentrates. Mason, is this something that happens in Colorado? What's your take on that?
What it comes down to is this, is that these are products that people want. If it wasn't in demand, someone would have gone out of their way to figure out how to make this process of consuming marijuana, of processing marijuana, and then it wouldn't have taken off and become very popular. So when we talk about regulating marijuana, the goal of that is to take this substance out of the underground market so we can control it. If we ban certain products, whether it's edibles, and you mentioned the possibility of edibles, and I recognize that there is potentially a need for compromise, I would strongly argue that it is not a good idea, because what you're going to find is that edibles will still be out there. People might just be more likely to make their own, and they'll be less consistent, they won't be tested, they won't be properly packaged or labeled, they won't be in child-proof containers, any number of things. I mean, the point is that if we were talking about a product that if you accidentally consumed, you were going to die, okay, we need to have a much, we need to consider the possibility of banning them outright, but it's just not what we're seeing. So, ultimately concentrates, hashes, shatter, all these things. It's really the difference between having a shot of vodka and having a beer or a glass of wine, to each their own. And what we need is for people to understand the difference between dabbing and between, just like people know that having a shot of tequila is much different than having a beer. There are certain things that need to be regulated though. You referred to butane, so hash oil, there's a process of extracting that uses butane. And there have been occasions where we've seen explosions, and this is really just another case for regulation. I mean, we need to take that process out of the hands of random people and have it done in properly zoned areas where, if this product is desired, then let's ensure that it's being produced safely and responsibly. With regards to the blowtorch, dabbing drives me, insane in terms of a policy issue, not in terms of music. It is, I will say, it is honestly taking marijuana and making it as dangerous and bad and shady looking as possible. It's really baffling, but we'll see innovation, and that's something, that will continue to have this. Right now, it is this crude blowtorch on a piece of metal, dab oil on it to inhale the smoke. But what that is there are people looking at it saying, well, that's so 2014. Like, let's make this a product that's easier, that's safer, that's encompassed. It's not a blowtorch, it's not a nail, and at the very least, take those shady elements out of it.
I want to go back just a little bit, and it feeds into this. With regard to concerns about legalization and regulation, I think that part of concerns I definitely have heard and honestly share is that the marijuana industry is going to become powerful like the alcohol industry or the tobacco industry, and it's around what I think is as a great opportunity is that we're having these discussions now while we're figuring out what to do, and it's at the beginning of the industry. I think that it's likely there's going to be a lot of people who want to make money on it, absolutely, and I like the idea of a monopoly too. Is that passable? Yeah, I don't know.
Yeah.
But
No.
Okay.
I was going to get to what I think is passable.
Okay.
And this
Well, so I was just gonna say that I think that we need to take this very seriously in terms of an opportunity to regulate and work with the industry as it grows in ways that we did not have an opportunity to with tobacco and alcohol. And so I think it's a training that's happening, and to be at this level of discussion before it's really going is really important.
I'll just briefly touch on this in that if you want to wait and see and have the conversation on those kind of things, whether it be butane oils or how edibles should be labeled, packaged, or regulated, then you can wait and see and not pass legislation. Or you can pass legislation based on what is fairly irrefutable, is that we don't have to talk. We just demonstrated it in this discussion right now. If we're talking about the outliers, but everybody agrees on what comes in the baggie is probably okay to tax and regulate, and there's not a lot to be done to do that. But we may have to wait and see on other things, whether it's a good idea or a bad idea. We'll argue about it for a while, but we want to tax and regulate what we can without waiting and seeing. And we have to leave some things that those who are a little more sophisticated in the way they look and talk about the conversation will keep talking about.
So, Mason, you want to?
I just wanted to jump in on one of the big arguments that is being brought up quite a bit, both primarily by those who are trying to keep marijuana illegal, but also in the news, and it's a very relevant conversation, is this notion of big marijuana, the industry, and so on. Now, quite frankly, I wish I wish our society wasn't entirely driven by capitalism and money. However, this goes back to that real world we were talking about earlier. The fact is that businesses exist because, by and large, these are people trying to make a living, and what we should be pursuing are, we should be trying to ensure that these are responsible businesses, not just in that they are refraining from advertising to children, but in that they're providing living wages, they're providing health care, they're respecting various community standards, all those things. And those are all things that can be done through regulations. In Colorado, it was one of the marijuana industry organizations that really spearheaded an effort to ban outdoor advertising. Sign twirlers. I mean, is there really a need for sign twirlers for marijuana stores? Probably sells itself. But the members of the industry recognize that this is not a good idea. It's kind of like with alcohol. It was DISCUS, the Distilled Spirits Council, years and years ago said, okay, we better institute some serious rules or these people are not going to let us continue to survive. So they put their own restrictions on advertising. Most of the ad restrictions when it comes to drinking are self-imposed. Things like not showing people actually drink, watch liquor ads, watch beer ads. No one really ever puts the bottle to their mouth. Stuff like that. Those are self-imposed, and we are very likely to see that type of thing from marijuana businesses that also want to exist. But I guess the point is, and that all said, we often hear this discussion of the big marijuana in the context of big alcohol and big tobacco. Okay. If big alcohol and big tobacco decided to switch to marijuana, it'd be like the biggest public health benefit in all of history, aside from maybe penicillin. I mean, it would be massive. So we need to keep this all in context. I mean, there's big alcohol, there's big tobacco, there's big pharma, there's big farm, there's big household products, Procter & Gamble. There's all sorts of, these are all industries. Marijuana being, if it's a legal product, will have an industry. So, in and of itself, that's not necessarily a bad thing, especially when you consider the fact that this product is not alcohol, it is not tobacco. And so that is just very important to keep in mind.
Well, I think that's a good point to end on. I think, democracy has been described as a lively experiment. I think it's safe to say that the discussion will continue. Let's just give a round of applause real quick for our panelists.